guys, today I want to run through with you how to explain to a patient what aligners are. So I'm going to use my Invisalign model just to demonstrate this as if it's a patient. Okay, so aligners are clear invisible trays, and you need to wear these aligners for 22 hours per day. Now, these are a hard plastic, it's slightly flexible, of course it's nice and discreet. The trays are trimmed just to the shape of your teeth, so they're just covering the teeth really nicely and they fit really snugly and quite comfortably as well. 22 hours a day where you're taking them out when you're eating or when you are cleaning your teeth, otherwise you're going to wear these aligners all day and at night time when you're sleeping. Drinking, you can drink water and hot drinks with your trays in, but you will need to take them out if you're drinking anything that contains sugar or anything that's fizzy. You're going to change your aligners every week or as instructed by the dental practice. And your aligners basically are moving your teeth around. Each aligner that you change weekly will be different, so each one of these is moving and changing shape slightly, and this is what's going to give us the movement to be able to push your teeth around. Then we need to think about how our teeth know where they're heading. So what we will do here is we will bob what we call attachments onto the front surface of some of your teeth, and these, as you can see and feel, is basically just white filling material, raised bumpy bits, and you can see them on the model here and you can feel them on the teeth as well. So your aligners fit really nicely over the top of the attachments. Okay, the attachments are tooth coloured so you can barely see that they're there, and that's the idea as well. The attachments are placed on your teeth at the beginning of your treatment, and they will stay there right until the end of your treatment. Once your treatment's finished, we will lightly kind of shave this white filling material away from the teeth. It doesn't damage the teeth at all. You don't need an injection for this. What the attachments are doing is they're telling your aligners where to push and pull each tooth individually. Depending on where your teeth are in the beginning and where they need to go at the end of your treatment, we'll kind of establish how many of the attachments we place in and on which of the teeth. Everybody needs attachments, otherwise the teeth are not going to have any direction particularly. And as we say, they're tooth coloured, you can barely see that they're there. Then we need to think about how we're going to create space to make teeth move, and particularly if we have teeth that are crooked and really crowded. So we don't want to take any teeth out if we can help it with Invisalign. So what we would like to do instead is a little bit of light slenderizing or shaving in between some of the teeth, and this is known as enamel reduction. And what we need to do is go in between some of these teeth and create space so we have some movement to be able to make these teeth move. This really is not something that hurts. You don't need an injection for this, but it does feel a little bit strange and the noise can be a little bit funny as well. We're literally going in between some teeth with really it's kind of sandpaper, and we're doing this light sanding motion. We're creating space of a maximum 0.5 millimetre where needed in between some teeth. This doesn't affect the teeth in any way, it doesn't cause any problems for the teeth, and it's quite safe to do so. And that basically is how we're going to create this space to be able to push things around. Now, if we put all these 4 things together, so you've got your aligner wear, you're wearing them for 22 hours per day. You're going to change them every week or as directed by your dentist. You've got the attachments that are pushing and pulling the teeth individually, and then they've got your light shaving in between teeth that's going to create this space. And all of these things together is the way that we're mechanically going to move these teeth to where they need to be. So a couple of things to point out that don't affect everybody, but it's something you need to be aware of to help you make a decision. You may have a lisp for a day or two when you first have your trays fitted. You may slaver a bit more than usual when you first have your trays fitted. Again, these things are all things that will eventually go away. You are going to feel some tenderness and pressure because ultimately we're forcing these teeth to move through your gum and your bone. So this is to be expected for the first day or so when you first have your aligners fitted but also when you change them for the first few weeks as well. You may need to take some painkillers for that. Everybody is different, of course, but that's the things you need to know basically with Invisalign. You also may get some irritation from the attachments when they're first fitted, and this is just where your cheeks or your tongue might be irritated slightly just from those attachments first going on. But of course you will have your aligners covering them as well for the majority of the day. So again, that all settles down as well eventually.